In this video, we're going to look at the evidence of physical elements that can convince someone that there's damage present. And we're going to look at the reasons behind how they can still be present without damage, and how that understanding can help the person start to think about those physical manifestations of pain in a slightly different way and help them recover from it. If you're interested in this topic, then watch the video. So we're going to look at a particular question someone's asked, and it is a frequently asked question, but we're going to go into detail with this particular question because it really highlights a common query that people have when they think about the physical elements and the physical evidence that they have that comes with their pain. That makes it very hard for them to understand how the brain's causing that when there's something physical. So let's look at the question and then we'll break it down. So I'm going to kind of read it out to you. Hello Drew, I'm having trouble reconciling the idea that chronic pain is the brain overreacting with the presence of what appear to be physical manifestations such as muscle tightness, knots, trigger points. I'm an athlete and I've had glutes and low back pain, muscular pain for well over 2 years. 10 months ago, whenever I tried to get back to running, I was suddenly struck by a sharp, tight pain my left calf and had to limp home in agony. It would subside in a couple of days, would come back whenever I tried to run again. Each time took longer to subside. Then it started in my right calf in October 2021, and that left me unable to walk for 1 to 2 months. Haven't had any sharp pains for a couple of months. I've been gradually getting back to hiking, cycling and running. Today I had to abort a run again. This last happened in October, with the same tight, sharp calf pain and still unable to put weight on it. So whenever I go for a sports massage, I'm told my calves are tight and pressing on trigger points is painful. So I'm confused whether it means there's something physical there. I'm thinking fear, anxiety, trauma is causing muscle tightness, which is experienced as a low level pain day to day, which results in actual damage, fear when running. So perhaps not suited to the methods described here, or have I misunderstood the principle and is there another explanation? Well, so let's break that down. It's such common confusion, if you like, with the inconsistency with physical findings that person thinks is damage based. So let's take it bit by bit. I'm having trouble reconciling the idea that chronic pain is the brain overreacting with the presence of what appear to be physical manifestations such as muscle tightness, knots and trigger points. So these physical manifestations, they're the trickiest things for people to overcome, because it's almost like, yeah, but look at that there, that's real. It is real. And the physical presence of something you can touch, you can feel and you can sense it. And it responds to physical stimulus like movement or pressing it, you or someone else pressing it, makes it hard to believe that it's something manifested by your brain. I get it. But the thing is that all pain is manifested like that. Not just persistent pain, all pain. Cut your finger, have blood coming out of it. Pain inevitably comes with that if you're aware of it, but sometimes it can happen without you being aware of it. Okay, you can have damage without pain. You've woken up with a bruise and think, where did I do that? So sometimes you felt physical pain from an emotional situation, grief, relationship breakdown, job loss, dog dying. You know, these things are painful. You feel them. There's a feeling that comes with them. And you describe it as painful too. So you can get pain without damage, damage without pain. Yes, you can get damage with pain, right? With pain, but that doesn't mean every pain you experience is due to damage. So if you often are shown things that highlight damage and you make the connection with them, and the connection's fearful and frustrating and annoying, that's the error. It's a natural mistake to make, understandable one to make, and we all make it, but that's the connection where we constantly believe and react emotionally to the sensation that that pain we feel is damage or proof of it. So when you follow the logic of it, right, of this particular pain, because that's the belief based, I'm damaged and here's proof of it, I've got trigger points and muscle tightness and I've got an x-ray and scan and other things that support that. Let's follow the logic. Now, logical thinking isn't emotional thinking. When you're in pain, believe me, you think emotionally. You don't even think emotionally, you react emotionally. So let's look at the history of this pain, if you like. I'm a very amateur triathlete. It's a contradiction that actually triathlete, that's pretty hard training. You might be amateur in intent, but believe me, that's professional level of training. I've had a glute lower back muscular pain for over 2 years. 10 months ago, whenever I tried getting back to run, I would suddenly be struck by a sharp, tight pain in my left calf and had to limp home in agony. It would subside in a couple of days but returned whenever I tried to run. The person's describing what they think is an injury. Okay, I've injured it on the run, and yet the run isn't that. It's a run at a pace and a distance that's comfortable for them because they've set out to do it. Okay, but the person believes they're vulnerable, believes the calf's fragile, it's weak, or maybe about to go with anything that's overloading. Suddenly struck by a sharp, tight pain in my left calf. So they think they're tearing it or pulling it when they actually haven't. If you tore the calf in that moment, it would take about 6 weeks for the tissue to heal and another 6 weeks for it to kind of gradually rehab back up to the normal level. And what the person's saying is that it resolves over a few days. But they're also describing very fearful behaviours. I'll limp home in agony. I'm struck by a sharp, tight pain. It also has all this imagery of danger and fear. And the load at that point of injury isn't that great. She's not saying I jump off a 10-foot wall and bang, my ankle, calf explodes, and the kind of trauma you'd expect to be present with that kind of pain. You're not saying somebody hit me with a hammer in that moment and I fell down the stairs. She said she's on a run for the leg to almost tear like that. It's not really consistent with that kind of injury, and then the recovery time afterwards. Interestingly, we had a little dialogue on Facebook. I didn't answer fully like this, but I made her think about how she was feeling around the times the pain came, rather than just the activity and the load. And she noticed that it actually came on because she was almost saying, oh my God, I'm just about to make it. I'm nearly at the end of the run, I'm nearly there. So that kind of, I'm getting there, but could I get there without a problem? That's actually running through fear. And the presence of that fear with that certain load in that certain place, that's the trigger for the pain. It's a re-traumatization rather than re-injury. So rather than the pain occurring as damage or load on tissue breakdown, it's more likely it's the load, the thoughts and the feelings in a particular context. And your body and brain recognise that and think that's too much. And it triggers that unconscious brain neural pathway of choice for that particular moment to say that's enough, it looks like it's too much. Trouble is the person's in an activity they're desperate to get back to, bathed in adrenaline, so not really picking up on what might be coming earlier and maybe getting a little excited at the prospect of getting back to this thing they've missed so much. And we only do behaviour for a feeling. So to get that feeling back after you've not had it for a while, that comes with excitement, and that bathing yourself with adrenaline, like that cortisol, actually triggers the pathways that the brain thinks are the best ones to stop you overdoing that behaviour. It's crazy, isn't it? So the pain makes the idea so frustrating and fearful. The paradox is that those emotions that kind of prime the context of running and getting calf pain means that you don't need a large amount of load or a large amount of the same emotion to trigger the pathway again. And like any repeated pathway, once you do it a lot with the stress response, your body just learns it, whether it's good or bad. It takes no conscious thought at all. The pathway fires, it appears with such shock and confusion of someone that the conscious things we do hold about it, the perception we have it, makes it sensitise even more for the next time it's going to happen. So we're actually pouring petrol on the flames with our conscious thoughts of acting in the way we do with this pain, saying I'm in agony, believing it's damage again, and tiptoeing home and limping, and then being surprised why it settles in a few days and thinking, oh well, it must be really badly damaged, but I don't know why it gets better so quick. The thing about this is that it isn't anybody's fault, remember, about this, because quite often the pushing and the driving and that kind of excitement about challenging yourself and going hard, that actually has brought all the success of someone's life. They've got the rewards, they've got their approval, they've got the validation, they've got a sense of worth, a sense of appreciation from others and maybe from yourself from acting like that. So to see this pain as something that's any different other than to push through and fight means it makes no sense not to treat it the same way, and yet you've got to do absolutely the opposite thing. So when the pain kind of takes longer to settle after each attempt, eventually the person kind of gives up on the idea that they can overcome this. Listen to the next section. Then the pain started in my right calf, leaving me unable to walk for 1 or 2 months. I haven't had any sharp pains for a couple of months now, and been gradually getting back to hiking, cycling and running. Today I had to abort a run again. This last happened in October with the same tight, sharp calf pain, and still unable to put weight on it. So this new pain is really where the system gets really clever. So frustrating to the individual. So focused on kind of dealing with one pain and then let it settle, think I can go again, that when the pain pops up on the other side, it's not funny, but when a pain's designed by the organism to stop you from doing a behaviour, if you listen to it, you stop. If you persist, despite it lasting longer afterwards and becoming more intense, the brain uses the opposite side. It's a physiological mechanism called mirroring. There's an explanation for it physiologically. You don't need to know how it works, but it mirrors it. It's a bit like, lads, she's not stop running. Yeah, but we're giving her loads of pain, right? Give her the other leg. She hasn't done out to the other leg, doesn't matter, give her it. If the first pain doesn't stop you, the second one will, and it increases the confusion. What have I done? Haven't injured it. What is it? Is it my age? Is it my height? Is it my weight? Is it my trainers? Is it the weather? Confusion is crazy when this happens, but it's a regulatory feedback of what's happening. It's designed to try and slow you down or stop you from overload in a situation in your life that the body's already overloaded. Remember, there's a regulatory feedback of the past, of the present, of the current, and it's taking all of past, present and future, and it's taking all of those things into consideration in the moment that you are smashing it. And if you don't like it, it'll trigger pain. Okay, so when that similar pain occurs, there's lots more kind of confusion, isn't there? No apparent traumatic history for it, but this extra pain just represents another warning. Finally stops that behaviour. Person takes a break from the activity that their unconscious system is practically demanding of them, and the trouble with that is that the person's fearful and frustrated now about that activity, and that drives the mechanism without them even doing it. Creates enough conscious caution for the person to then gradually return to the activities which this person did. But when they try again, when that certain set of circumstances appear, attempt the running again at that distance, at that pace, the fear is still there, then failure awaits again. Just trips the switch. And when pain fires at a threshold of no injury, but the person believes it's an injury, then that cycle of boom and bust carries on. More fear and frustration. The pathways are heightened again for the next failed attempt whenever the person tries again. if you take these calf pains and trace the earlier pains present in this patient, there was actually something else. She had low back pain, glutes pain long before, and they hadn't resolved that before they then pushed on to the calf pain. So really the calf pains came on after, ignoring or not fully resolving the back pain. Okay, so the next statement, I've had glutes and lower back pain for over 2 years, so it's inevitable trying to push through a pre-existing unresolved and persistent pain. It doesn't fade, it stays, it increases, it's superseded by the first pain, and often then pain comes elsewhere in the context that's relevant, that'll try harder to stop the burst. If the back pain doesn't do it and they go running, well, the calf pain turns up. So another alarm, it's like a sequential alarm system. Sequentially, the next alarm and appears, and it's always in the context of the running or the sitting or the standing. It's the behaviour you're trying to do. The body will use something that's relevant. There's no point giving you pain in your finger when you're running. Well, in some people it might, but it's not very contextual. So the next point comes to showing this presentation to a therapist. Here we go. So whenever I go for a sports massage, I'm told my calves are tight and pressing on trigger points. Now anybody who wants to help you, they're doing it from their perspective, from their training and from their truth. The person's not telling you lies, but I don't really think this giving you the facts in your situation as I see it. It's only my perspective. It's a persistent pattern of pain, this. It doesn't follow like an acute muscle tear if you ask your history and if you listen to this explanation. It just doesn't. But some people might not do that exploration. You've got to look at other things. What else was going on in your life 2 years ago? Why were you running so hard? What were you running from? What were the emotional charges in your life? Why did you push past pain or through it? Did you have some personality traits that predisposed to this happening at some point in your life? What approach have you been using to address the pain you've experienced? Did you use these traits that brought you success to try and overcome your pain? And what do you actually believe to be the cause of your injury? Well, it looks like you believe it's damage in some way, some unknown mechanism that you're not able to work out. And that's what you're presenting to therapists, that you've got this kind of damaged perspective, and that's how they are looking and listening to you. But I don't think they'll explore some of those questions with you. I know you might not have done that either. So the clinician's looking for things that support that hypothesis that you're damaged. So tightness and knots that they find, they're the physical representations of the organism saying stop and stop this overload. Now they find that, and but they find that every week in people, just like I can find it in people who have pain and don't have pain. We've got little lumps and bumps and kind of shapes and sizes that we attribute to pain, and there's no relevance to it at all. It's simply where the person with pain has made the association that that's something that's damage based, and it's not. It's more protective based. But I'm not saying that you don't have this tightness and knots, but they're not coming from an acute injury because the history doesn't support it. They're a physical manifestation of your brain and body being in a protective state for that level of stimulus in the context in which you are trying to push past it. But what do the images of knots and tightness create for that person who's already scared? Does it increase the stress apparatus and its responses, or does it reduce it? It's almost like the blind leading the blind to say, oh, your leg's shorter than the other, and if there's a tight knot there and I'm getting stuck into it for you, oh, and you really, there's lots of tension there and your bones are out of place, and whatever other sort of language that people use. And don't get me wrong, I have used some of that language in the past, but not a lot of it. I've never been kind of big on that. But to describe the kind of signs of physical change that you witness in clinic and you feed that back to a patient who's in persistent pain in ways that are scary, it's a bit misguided. And I'm not saying I've ever made those mistakes, because I have, but I now know it's not the correct approach for persistent pain. Anything that's presented with persistent pain or a pattern of it It's got to incorporate a stimulus back to that nervous system of that person that makes that individual feel safe, authentically safe. Explanation's got to be thoughtful. Touch or treatment has got to respect the person's responses to that. The emotional intent of the therapist has to be based in understanding the kind of a scientific awareness of the neurophysiological mechanisms, and that's allied to the natural compassionate approach of most therapists. It should be all, but you know, not everyone's that compassionate. So the next question, or part of the question, is I'm confused whether this means there's something physical there or not. Well, yes, there is. There's always a physical element to pain, right? You feel something somewhere in your body. It's not your head, and there's no separation between mind and body. That's the distinction that we've kind of, it's been blurred. We're led to believe that there's two separate things. They're not. You've just got a context where that pain plays out, and you can predict it. This person, you know, she knows where she'll feel it, you know, which leg it'll appear in, more often than not. Sometimes it'll surprise her, sometimes it won't. She knows the words she says to herself when it happens. Interestingly, she knows what she said to herself before it happened, and that might help her kind of look at some of the emotional charges that are present before the pain, and maybe some of the charges that were present when this original pain started a couple of years ago. It might reflect the other things that have been apparent in your life at the time pain started. Maybe they couldn't control that situation. Maybe they went to bed with the thoughts and woke up with them. Maybe that frustration or fear or anxiety or annoyance that came with that means that we crave our favourite down button more, then we push a bit harder to run away from that situation if we can't control it. But that's an overloading situation that we lose an overload to try and recover from. And yes, it can help in the short term, but it can just trigger overload. That's where our quickest stress reducing activity always has its appeal, but it's adrenaline based. And if running is that person's thing, then running harder and faster and for longer, or just running with that sort of tension in your life, means that the body kind of rejects the proposal that you're saying, let's use adrenaline, cortisol to get over how we feel. And it's saying, no, you can't use this behaviour alone. It has to be it's done with a bit of balance. So the person doesn't have to have trauma with a capital T, just have to lost access to the down buttons, you know, and then returning to them after lockdown with a lot of people means that they hit them a bit harder because they missed them so much. And when you get pain from it, that's stressful again. You've gone so long without doing it, you keep running. So it's understandable, but that misplaced attempt to push hard and keep going, and when you're overcoming a time that's stressful or a thing that's stressful, it triggers. It can contribute to triggering this pattern. So the physical element's relevant. That's where the body's saying, "Look after me here," and this is what I'm telling you. This is the best way I can let you know, because it doesn't give you words. You don't get to say, "Oh, by the way, Drew, you're overdoing it, and you're using too much effort when you do your running to run away from the emotions of A, B, or C." It doesn't say that to you. It gives you a feeling that you have to interpret. Just like you have to help a child interpret a poorly tummy. Could be lots of things, but you've got to explore it. So the following statement shows where the person is at the moment. I'm thinking fear, anxiety, trauma is causing muscle tightness, which is experienced as low-level pain day to day, which results in actual damage tear when running. Now, two parts to this. Yes, the fear and anxiety is causing muscle tightness, but there's no new trauma. There's no new trauma. She's misinterpreting that part of it. Experiencing a re-traumatization. The person experiences some of the experiences linked to trauma, and the brain's triggering pain, and the person believes it's the feeling that comes with injury. It means it is injury. Well, if you think of grief and a year or two down the line you cry on the day that the person's birthday appears again, they don't die again on that day, but pretty much feels like they have. So the body is going into the same state, tears and you sob and whatever else comes with that, and yet they died a few years ago. So it's going through it's almost like a re-trauma that the brain and body are having. The person's interpreting it as a brand new injury. So that residual emotional charge is the pain day by day. That's the driver for that little ache, if you like, because the loads through the leg on the running, the loads through the leg on day by day activities aren't that great and wouldn't cause damage to pretty much anyone. Well, it just shows there's a protection mechanism there, and the system's so primed that as soon as you put weight on your legs, it's telling you this looks like it could be overloading. It's not saying that there's still damage, it's asking you to go carefully. And it's the last chance it has before you actually start the run. So pre-match nerves are pre-match. Once you're in the match, there's no nerves. And post-match kind of sensations are different from when you're in the match. So before and after are often when pain's experienced, because when we do the activity, we bathe in adrenaline. It's only when it's so sensitive and we've ignored it for so long does the pain come during the activity. The pathway, it's come so intertwined with the prediction of overload that it's saying quietly in the background, lads, lasses, as soon as she opens her eyes, based on what she's been doing yesterday and what she might do this afternoon, give her the pain, just at a low level, just to keep her held back. We won't have long, because as soon as she starts, she normally smashes it. It's trying to protect you in a way that sometimes we misunderstand. It's trying to protect you from you. Maybe not from running in reality, because that's not a dangerous thing, but it's just the sense of overload that was learned in the moment that running was part of that. And remember, the unconscious mind is almost stuck in time of trauma. It can be stuck in the time of trauma. So if anything appears that looks like very thing similar to the time the first overload happened, the warning comes much quicker than it might have come at the start, because it allows you a little bit of leeway. So the pain's probably wired to the feeling of overload from the stressful circumstances which may or may not have been apparent to this person around the time the low back pain started, and now it stops you doing anything it considers overloading. You might recognise that you've got some of the traits that push through things, and that it might have helped the person achieve a lot in life, but actually you can't use that approach for this pain. Using a gentle and a balanced way to change how you feel and how you run is the way to reverse it. You can use physical methods to do it, but not just biological processes of pushing hard and stretches and kind of rubbing it. And you've got to look at how you feel before the run, during the run, after the run. Setting a timeline that means that you'll run at a slow pace and you'll run less. Some sweet spot where there's no fear and there's no frustration. And if they appear, you've got to be rational enough to say, okay, I'll go slower, it's just my body. And so you expose yourself to the threat, physical threat or the circumstance of it, but you do it in a very controlled way. Some people have to walk the route. Other people have to start imagining the running, or run at intervals to control the urge not to run too fast or lose themselves. You've got to be purposeful. You've got to have a bit of poise. You've got to kind of be thoughtful about this. You've got to be conscious. You can't just unconsciously crave the feeling and go for it. You can, but you'll fail. Sometimes there's a breathing exercise I've mentioned, and in other videos you can see it. Sometimes regulating your breathing before you do this activity, just like you practice your words before a speech. Just like you take some deep breaths after you ran for the bus. If you take some deep breaths before, the run will be easier if you can prepare for that. So if you know you're going to put your body in a state of challenge, breathe before you do it in a way that regulates the nervous system and regulates some of its responses. Notice the circumstances around your life and the traits you had maybe that dealt with the stressful situations back then, and you don't have to kind of go back and explore it in massive detail, but you might just notice you probably did push a bit hard. And if you didn't notice it and you're kind of pretty good with the stress response, then, and you say I'm not stressed, well, your body is, even if you don't acknowledge that you are. And often that's just a bit of denial, and that's okay. If you want to change the pain, you'll start to look a bit closer at that. But if you can incorporate a more balanced understanding of how you deal with stressful situations, it might be one of the best learning experiences you can kind of come across. And it was for me. And many others have gone through similar events and kind of sort of talking about this person, I wish this person lots of success with their tiny steps of recovery. So the last part of the question, nearly done. So perhaps perhaps am I not suited to the methods described here, or have I misunderstood the principle? Well, you're absolutely suited to the methods described with the pain habit. Yes, you've misunderstood part of the meaning of the pain, but it's an easy and common mistake to make, and patients and clinicians making the mistake every day. Some go a lifetime without ever fixing it. Some never recover from pain. But the explanation I provide is the best I can give. I haven't examined this person, I haven't looked at the calf or the back. It's kind of a perspective based on theory, and kind of can't really say it's clinical advice. It's a story, it's an example that other people might be able to take information from. And if this person decides to go back to running, it's entirely up to her how she does it. And if you want someone to assess you and guide you on it, then fine, find someone. But you don't really need the physical check-in. This person can be their own coach, and you can be yours. You can go to people who can help you along the way, but only go to those who understand this process. It's not the fault of the person who maybe finds the knots and tells you they're tight and does these things. They're already doing what they think's best for your pain and how you present it and what they currently know. There's different ways to think about persistent pain and different ways to think of acute episodes of persistent pain, and really there's not many times when they are actually new damage. What you know now should be enough to consider that a route back to running, a recovery program, takes in kind of all the aspects of who you are and looks at the whole you, and if you can kind of do that with this sense of calmness, consciousness, following a plan, it's not so driven that it has to be analysed and measured and kind of judged, which just, I'm okay and I'm enjoying getting back to this, I'm going to go easy, I'm going to take my time, I might walk, I might imagine it, I might take some steps, I might interval run. Then there's a great chance you can get those running shoes on, smile and take those first few steps to start feeling amazing again. I hope that question that I've explored in quite a lot of detail is something that helps you understand other presentations of persistent pain and these physical elements that often confuse patients and clinicians alike. And it's confused me in the past as both a patient and a clinician, but the confusion is fading. There's still lots I don't know, but I know persistent pain can be reversed. No matter what the structural elements you find to tell me otherwise, I know you can keep those structural elements and recover. And many of those structural things and physical evidence that present as evidence to support that belief, once the belief change, you'd be amazed at some of those physical manifestations fade too.